Hello friends, how are you? This is Dr. Shinagi, Ayurveda and medicine doctor and also Isha Hatha yoga teacher. So today in this video we are going to talk about what to do if our test reports, the clinical test reports turn out to be little bit abnormal, not too much abnormal but borderline abnormal. Or you can also understand it as when test reports is not normal, what to do. You must be thinking every fool knows what to do if the test reports are not normal. But now when I am saying the test reports are abnormal or not normal, that also comes under various categories. Sometimes like your test report, whatever the test report has come, it is just a borderline difference, like little bit, even 1 point higher than the borderline or 1 point lower than the borderline. It's not like very much abnormal, it is just little bit abnormal. And for usually after these tests, when we go to doctors usually say report is there, it is almost okay, it's quite normal. Because these days if you will see, everybody's test reports are little bit abnormal. So this abnormality has become so normal that even because doctors have habit of seeing the very bad reports, the abnormality is too much high. So when a patient with little bit abnormality comes to them or little bit borderline abnormality comes to them, then they say it's not bad, you're quite healthy, it's good. Because it is not very worst, it is just borderline abnormal. So doctors have this reaction. One thing, they don't want to scare patient like what has happened. So that can be the intention. Another intention is because they have seen so many bad cases, that little bit bad case that is appearing to them, it seems to be near normal, not normal but near normal. They don't consider it as abnormal, and they also say to patient, no need to take any tension. But we need to pay attention here. If some test report is abnormal, it can be sometimes also it's a clinical methodology defect, like sometimes clinic methodology people are not doing properly. But if you see certain symptoms are there in the body and certain test report is also abnormal, I think it is the time that we should pay attention to it. We should go to the root cause, why is it so, and why the symptom related to that test is there in the body, and what is its relation, my disease is heading to which direction, or I am heading to which disease. Then these abnormalities becomes very, very significant, especially if these are borderline abnormalities. Because if the abnormality, if the not normal thing is beyond like borderline, like it's quite high number, then the doctor itself will say like, okay, your tests are not normal, do this, do that, he will guide you. But if it is borderline normal, then even doctors don't pay attention much. So it's very important that if the symptoms are there in our body that related to that specific test, and if test is also little bit abnormal, we should pay attention to it. And this will increase the significance of mild not normal or mild abnormal tests. So now if let's suppose somebody's tests turn out to be little bit abnormal, so what we should do? So first thing is you go to the doctor and please ask, please doctor, can you tell me what might be the reason of this abnormality? If that doctor has, if you are that specific doctor's patient and he has time, if there is not huge queue of patients and emergency, and if doctor will have time, he will guide you like this is the test is abnormal because this your organ is impacted that much, so you please take care. So it's very important that you take advice. If doctor is saying, oh, it's normal, nothing, go. That, and by these words you are thinking, okay, everything is normal. I feel like it is a better option if you pay attention and see if this test is there, maybe there is some underlying cause for that, and if it is little bit abnormal, maybe it is better to seek guidance. It is related to which my symptom or which my condition or which my underlying disease. So this is very important. next thing is, once doctor will tell you like this is the thing, that is the thing, then you also can check like, is my diet pattern, how I am eating. This is also kind of guidance, you know, how I'm eating, how I should eat. Let's suppose somebody is diabetic, then if somebody is mild borderline high diabetes, high sugar levels, so you very well know like, okay, it's mild diabetic, doctor is saying no need medicine, it is almost okay, but you just take care of your lifestyle. Now what lifestyle? Lifestyle is that like you should cut all the sugar, artificial sugar, cakes, pastries, all these kind of creamy things, chemical sugars, totally stop them. So these precautions we ourselves know, like sugar, hypertension, cholesterol, like if cholesterol is there, then fatty things you need to remove from your diet. But there are other diseases also, like little bit mild problem in kidney tests or mild problem in liver tests. Then what you need to do? Then maybe you should take care of your liver, maybe take care of your kidney, or if mild impact in your heart is there, then take care of your heart. These things are also very important, because sometimes these our little steps can make big difference in our future. Next step would be, if once you get to know what is the cause of the disease, which organ related problem is, then you go to home or you go to some dietitian or go to some traditional medicine doctor or Ayurvedic doctor or homeopathy doctor, just read about the disease and discuss the case with them, like it is just a mild abnormality and allopathic doctor is saying it's almost normal, no need to take any medicine. So should I take some herbal support? Because in allopathy for mild problems there is no treatment, because they start treatment unless your disease will cross certain points, then only they put allopathic medicines. In chronic diseases, I am not talking here about infections, here I am talking about these chronic slow progressing diseases. But in Ayurveda, in homeopathy, they are very symptomatic related people. Like if certain symptom is happening in Ayurveda, it is known as Purva Roop. Purva Roop means pre-symptom, means the symptom that is before, pre-symptom is the symptom which appear before actual symptom. So in Ayurveda, about every disease, a lot of importance has been given to Purva Rupa. Like there is certain kind of symptoms an Ayurvedic doctor can observe in you, and according to that he can tell you like this herb you take, this Ayurveda medicine you take, this lifestyle you follow, and you will not land into bigger symptom and the disease. So in Ayurveda, as you know, it's a precautionary system of medicine. Like if disease has not manifested in the body, before the disease will manifest, we should stop the budding symptom, means we should not suppress the symptom but remove the root cause. Maybe let's suppose somebody has diabetes and root cause, in the morning you are taking a juice full of sugar, or maybe in the packet big juice you are taking and you have borderline diabetes, this market packed juices you are taking, and as you are not aware, like these packed juices are full of sugar and you are taking these juices. So simple root cause remedy will be you remove that juice and your sugar will come under the normal limits. So this is the important of paying attention, like of being aware and paying attention, like what could be the root cause and what I should remove from our diet and lifestyle. So these things are very important. Now the question comes, so I am talking all these things, so I am very aware about my health, no disease at all. I wish I could be like that, because when I was growing in my growing years, when I was studying in college and school years, I was also unaware about diet, lifestyle. I was eating all kind of junk food, like all whatever is available. So that kind of junk food I was eating because temptation of the tongue. And then I paid a huge price by creating problem in my lung, like a big way, which is to some extent is totally damaged and some point it is left. So I need to maintain with the help of Ayurveda, and when diseases attack or certain chronic disease start taking birth, you need to then, because if lung capacity is low, the immunity is also impacted, and then you need to take certain herbs, certain medicines to maintain your life. Because I got myself on inhalers for I think when I was very young. and it went on going, and later Ayurveda has saved me in a big way. So it has cured me totally. No, I can't say this, but it has maintained me well. So I don't want like other people land into the same problem because I was unaware. The other people should not be unaware and do the same mistake as I did. You should be more aware about health, more taking care of health. This way you can save your a lot of organs and a lot of your body health and a lot of your money and expenses. It is just a matter of paying attention and being aware about the health. Next thing is also see like now let's suppose what are the universal things which will work on all diseases. So all disease that can work on is from Ayurveda perspective. If you see like have your dinners early if possible, convert your food 50% raw, 50% cooked. That means 50% should contain fruits. That is very beneficial in any disease. In addition to that, you can also use some overnight soaked nuts. If you are eating nuts, soak them overnight and eat. Don't overeat nuts. Nuts you can choose according to your disease. If there is some disease in which nuts are not allowed, you should not eat nuts. If you have some disease related to your stomach, then avoid the milk as it is. Packet milk totally no. Try to avoid all the canned, packed, tinned foods. That is universal things for all the diseases. In addition to that, try to have freshly cooked food. Don't take food from refrigerator or the food that is packed or preheated food 1 month before or 2 months before. These packed biscuits and everything. This is not good for health. So these are the universal precautions that you can take in almost all diseases. If you have test that is borderline altered and doctor is saying it's almost good, no need to do much, then you can pay attention to your lifestyle, exercise, stress management. Means if you have some stress related problem, then try yoga, meditation, various kind of yoga asanas, practices. There are various yoga schools all over the world that help you to learn yoga. Or if you have no idea about yoga, you don't know what yoga is. So there is on YouTube, there is a link like Isha Upa Yoga. The name is written in the screen below. So this Upa Yoga practice you can start doing. This is also helpful. In addition to that, there is a Isha Kriya that is also from Isha Foundation. That also you can do. That is also very beneficial. In addition to that, there is Hatha Yoga, or if you are in contact with certain schools of yoga who teach yoga, so from authentic yoga, the classical one, then you can learn that yoga that works on stress, and meditations also you can learn. That is also very beneficial to combat the stress, and work on the self consciousness. That also will be very beneficial on the stress. In addition to that, outside also try to remove the stress factors which are causing a lot of stress. That is very important, because till we are not internally so much developed, we should not live with the stress causing factors that also irritates our, that also make our stress too much. So little bit you need to pay attention, like what is creating problem in your life. As I mentioned, if the tests are little bit abnormal, the changes that I have mentioned you, these changes if you little bit do, very much possible, like after 2-3 months when you do the same test, it will be turn out to be normal or under the border limit, under the border, like not abnormal, borderline abnormal, it can be normal. But if some tests turn out to be some disease, then definitely then your doctor will guide you like what to do, which organ related this disease is. But these tests which are with little bit abnormalities, these just can be bring normal by lifestyle modification with some Ayurveda herbs or Ayurveda medicines or some homeopathy or some traditional medicines. But also that is very important that you approach a good doctor, because if you are approaching a person who don't have knowledge of his subject, then you will not get good results. Let's suppose if somebody is doctor and he has done 6 to 7 years of studies in doctor, is treating patient, and if you are going to a person who has just little bit 1 or 2-3 months courses, so you can see the understanding of the disease and authenticity and all these kind of things also matters. So when you are choosing Ayurveda or traditional medicine, it is very, very important that you search the trustworthy source, not just random everywhere, because it is not like mistakes can happen from any doctor. I am not saying that, but still we need to pay attention, like with whom, from whom we are taking medicine, because medicine can cure you, medicine can also be poison, is not taken in proper doses without proper doctor's consultation, and self medication is not at all good. Even the tests are little bit altered. You should always take advice from the specialist, the expert, then only you should consume that medicine. So that's all for today's video. Thank you so much for watching, and if you're watching me for the first time, there is a bell icon, there is a subscription button. Please click the bell icon, hit the subscription button so that you stay in tune with our upcoming videos. Also, if you would like to support us, there is a join button near subscription button. You can click the join button and you can support us. Those of you who want Ayurveda consultations, please write to me on this given email ID and I will let you know how we can schedule it. If you have any questions, please write down those questions in the comment section. I will try to answer your questions in the best possible way. So with this note, I would like to say stay healthy, stay blessed, take care. Bye.